What's up, friends and family? I'm with you here today creating this video because the fact is the amount of anecdotal research nowadays is overwhelming. Please stop listening to your next door neighbor who has no clue of what the flu virus is, let alone the COVID-19. And this is what is destroying our population and what's destroying our friends and family. And this is why I got this video and I'm creating it for you guys. And this is on the common questions, Mythbusters, and the facts on the COVID-19.
Beats Universe.
Question number 1. Is the coronavirus a new virus? And the answer is very simple. No, it is not a new virus. In the past, we have dealt with similar strains of the coronavirus, such as MERS and SARS. MERS, which stands for Middle East Respiratory Syndrome, and SARS, which stands for Severe Acute Respiratory Syndrome. These are also strands of the coronavirus. The one we are dealing with today is a different strand and a novel strand of the virus, which is the COVID-19. Why do we name it coronavirus? Well, if we break it down, corona stands for, and it's Latin for crown, and then virus. If you put it together, crown virus. Why do we call it the crown virus? Because of the crown-like protrusions or the receptors that's coming out of the virus body. The coronavirus can't live in cold or hot temperatures. This is also false. Why? Because we have seen and we are seeing spiking trends in Russia of the COVID-19. And Russia is one of the coldest countries on this planet. Also, the coronavirus is also able to replicate in the human body. The human body's normal temperature is 98.6 degrees Fahrenheit. If you ask me, that's pretty warm. Should we be wearing a face mask? This is a very good question because wherever you go nowadays, you're going to see people wearing a face mask. Now, what type of mask is it? It's a surgical mask. But when discussing this topic, we have to bring up the two common types that everybody is talking about. We are talking about the N95 respirator, and we are talking about the surgical mask. What is the difference? The N95 respirator is the professional form-fitting mask that you see the doctors and the nurses wearing in the hospitals. And these masks are used to protect themselves. This mask is used to keep the virus outside, all right? And then you have the surgical masks, which are used to prevent from you putting the virus out. So these type of masks you're gonna see in the hospitals that the infected patients are wearing. This is why the WHO and the CDC are recommending that only the infected people and the people who are experiencing symptoms of the COVID-19 and who has came out positive of the COVID-19, these type of patients are wearing these surgical masks because they're protecting the general population, all right? Because this mask helps keep the virus inside and not infect anybody else. And if you ask me, logically speaking, patients are asymptomatic and you never know who's infected. Everyone should be putting on a face mask, all right, to protect you and your loved ones. Is hydroxychloroquine and azithromycin effective against the COVID-19? Now, we have seen cases where they have used this combination drug therapy in France and people have been coming out symptom-free of the COVID-19. I don't know if we're using it now in the United States, but there was a recent research done used with a small sample size saying that the combination drug therapy of hydroxychloroquine and azithromycin was in fact effective. What is hydroxychloroquine? Hydroxychloroquine is an anti-malarial drug. It's commonly used for rheumatoid arthritis. And azithromycin is a common antibiotic, which is commonly used for a chlamydia infection. Now, when used in combination, we are seeing that it decreases the viral load inside the human body. Why? I don't have the scientific data for you right now because they are still doing research. But what we do know is that hydroxychloroquine is used to decrease the viral load inside the body, meaning the numerical value of the virus inside any given volume. And when used in combination in an adjunctive therapy, azithromycin is helpful. Azithromycin adds to the effects of the hydroxychloroquine. And are we using that now in the United States? I am not sure though, but I'm pretty sure that I've seen somewhere on the news where they're gonna start using this combination drug therapy in patients. But it has proven effective in France. Question 6. Could ibuprofen make COVID-19 symptoms worse? We are starting to see an increased anecdotal research where a lot of people and news reporters are saying do not take these anti-inflammatory agents because they are going to make your symptoms worse. The fact is that this is all false. This is all very much false. This is another common anecdotal evidence that we are seeing. Anecdotal meaning like it is passed down from mouth to mouth. There is no research behind it. It's all somebody's beliefs. It's all somebody's personal understandings. It's not based on scientific facts and it's not based on research. All right? And research has shown us that there is no evidence to prove this correct. In fact, the World Health Organization has released a statement about this, saying that they do not advise to discontinue your anti-inflammatory agents or your drugs such as ibuprofen while on the COVID-19. If you feel like ibuprofen is going to make your symptoms worse, okay, that's fine. Put the ibuprofen down and pick up acetaminophen, which is Tylenol, all right, to ease your mind and your conscience. All right, and I want to thank you guys for tuning in with me today. If you have any more questions, comments, or concerns, you could just drop them down in the comment box below and hit that like, hit that notification, and hit that subscribe button because I want to hear more from you guys, all right? Thank you. Love you guys, and as always, stay blessed and stay safe and healthy. No, what the hell? What take is this? Like take 11? More importantly, protect your family.
You know what you can do too? Is get
It's too late for that. We're already in the video. And
I'm just telling you for next time.
Okay.
Okay.